Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. Of course, we're heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. And I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in, to join in. Today, you better take me up on my offer. We got a number of guests coming up in the up-and-coming shows. We're going to leave it open for you today. Of course, I always have something on my plate to bring to you. But if you're sitting back there and there's been something that, some scintillating topics over the last many weeks that you want to bring up to us, whether it's related to any one of those topics or whether it's out of the clear blue sky and it's just bothering you, how about giving us a call today? I'll listen for that knock on the door once you dial us up at 412-825-6262. That's 412-825-6262. Open phones today. Take over the show. And whenever you feel like you're ready, I'll be ready for you. Hope you had a great weekend. A little soggy yesterday, depending on where you were in the city. A lot soggy. But these up and coming next few days are going to be gorgeous. I'm looking forward to them. I hope you are too. Up and coming, of course, too, are scheduled guests for closing out the month of July and kicking off the month of August. Yes, we are in the last month of July, ladies and gentlemen. Those smiles on your faces, please. As we get to August, I know school's returning. Those little ones, those little lovelies are going to be going back soon, believe you me. You can start counting backwards. Well, we'll wait till we get to Friday, then you can start counting backwards when we actually hit the month of August. And we do so by turning the page on Saturday, well, into Sunday. Let's see, coming up here on Wednesday, a gentleman we've had on our airways before. He is named Doug Inglesby. He's going to be talking about how the FTC and the FDA are fixing, in the words of the great Al Gore, fixing to interrupt your breakfast with what you may have on your breakfast nuts. SpongeBob turns out to be the culprit, and other icons like him. We'll be talking to Doug Inglesby on Wednesday about SpongeBob out of your cereals. Good thing, bad thing? I don't know. Looking into the month of August, we're going to have Vicki Southard here. Now, let's pull this up. I got a stack of papers in front of me, and Vicki Southard reveals how to slim down a stubborn double chin. And we've never talked about this on our airways before. By the way, we will be talking about double chins, and so in the up-and-coming future. And I thought this was a good start here. So Vicki Southard's going to be with us on Monday, August 2nd. Then on Wednesday, very serious topic, and I mean extremely serious, with respect to this memory loss issue, the possibility of something like Alzheimer's disease, or we just call it in the industry OBS. They always have an acronym for various diseases. OBS, of course, stands for Organic Brain Syndrome, and it's something that scares the bejesus out of all of us. We've been given a ray of sunshine coming through the window when it comes to how to take charge of a situation we didn't think we had the ability to take charge of. And that has to do with our own memory loss issues or those similar issues that may occur in our loved ones. Anyway, Mark Underwood, the owner, the inventor of a substance, a company that produces that substance, we've had him on the air. We thought so much about it, or at least I did, that I brought that product into the office. It's called Prevagen. It comes from jellyfish. And some remarkable things are in store for you. I have many patients who have taken this product and have told me that they feel improved by taking this. We have a number of things we'd like to do to discuss with you, by the way. If you have any memory issues at all, to put a combination together to allow you to take charge, I believe there's quite a bit to be done. On Wednesday, the 4th of August, Mark Underwood's going to be coming back. And yes, we'll be talking about Prevagen, because I think we should take every opportunity that is presented to us to have the individuals who discovered this material, coming from jellyfish, like I say, a calcium-binding protein, which is, by binding up calcium, doesn't allow it to penetrate the cell membrane of the living cell. And boy, if it penetrates that cell membrane, talking about calcium, it leads to cell death, and is one of the reasons why you can have neurological deficits, neurological damages. Anyway, there's a blood test out there. Normally, people should be running for the hills, right? I think I've often said, geez, if they ever came up with a blood test to let you know about whether or not you have Alzheimer's, how many people would ask for it? How many people would want to get it? Well, if you could do something about it, wouldn't you want to know? So you could take some steps early? That's what we're going to be talking about when we get with with Mark Underwood on August 4th. Now, we skipped then a couple of weeks, one of which, by the way, is going to be a vacation week for me. You can start calling up, because in the week of the 16th to the 20th, we won't be doing any live shows. Got plenty of time to fill in these spots. What are the shows that you want to listen to that we've done recently and maybe you've missed or maybe you heard and want to hear again? When you call us up, hey, if you have a special request, as I'm filling up that week of those requests of shows we've done previously, give us a call and let us know. For the shows of 16, 18, and 20, they won't be live. And so that's one of the 2 weeks. Jump into the next week. On the 23rd, when I first told you about this on Friday, I had a call on Thursday of last week from, boy, if the word old friend is ever applicable, it's certainly to this gentleman's name of Jim Navarro. The trials and tribulations that Jim and his whole family went through in the early 2000s. I looked it up, and it's back in 2001. 2000 and 2001 that we were brought into this epic saga, the trials and tribulations of his son, Thomas Navarro, who had a brain malignancy and was literally running from the government and all authorities because they were being forced into pursuing a chemotherapy that neither the family or the child wanted. And we literally caught Jimmy in many places where he, I guess, could be said to have been on the lam at the time. And every week or so, we were talking to Jimmy from another location that he had to move to. Anyway, his son eventually died. Little Thomas, died on November 19th, 2001. He was born on July 5th, 1995. So as you can see, a real youngster at his death. Anyway, a documentary we put together. It's going to be released at about the time of the anniversary of his death. Jim had a whole bunch to tell me, but said, you know what, hold off, don't reveal anymore, because I'll have more actual facts to reveal to you by the time I come on your show on the 23rd. So, before he brought up some names of some folks that we had at the time. It was Congressman Burton. I don't know if you remember him. He played an active role in trying to help the Navarro family at the time. Beth Clay, his administrative assistant. Bill Chatfield, and I see the actor Peter Coyote is going to be doing the narration of this documentary. We will give you advance warning with plenty of time as to when this documentary is going to be released. I understand it's going to be released to be playing in theaters, which is a pretty surprise to me. Then on the 25th, we've had this book now for quite some time. Yes, he'll be here talking about our guest, Dr. James Roberts, an extraordinary cardiologist with an extraordinary practice literally in our next door here. He's in Toledo, Ohio. But he is known for many things. One of the things you know him for was the collaboration that he, in collaboration with Dr. Steven Sinatra, another cardiologist, wrote a book. I call it the textbook of how you want to be cared for with respect to your cardiovascular situation, your cardiovascular disease, either of now or in the future. The book is called Reversing Heart Disease Now. I suggest you all get a copy of it. Be armed with it. If you're going to be seeing any conventional doctors, it will give you credibility for many of the things that, well, we teach you here on our show. It may be good for you to feel enlightened, but it isn't healthy for your doctor. Your enlightenment is not a healthy situation for your doctor. It's getting him pretty upset, gets a little worked up, may need a little bit of some relaxant to even meet and greet with you because your knowledge is a dangerous thing. And we get it from guys like Jimmy Roberts, who'll be with us on the 25th. Now, that's the schedule as it turns out right about now. And we'll be filling in some other gaps. Don't forget, give us a call. You can even do that today, 412-825-6262. If you have some requests to play previous shows during the vacation week of August 16th to 20th, and get 3 slots to fill, and you can help me fill them with your request, and we'll let it go at that. By the way, what is your BBT? It's your basal body temperature, and that'll give us a really good fix on your thyroid status. How many of you have done that? Have you taken your basal body temperatures since we brought this issue to you last month? And do you know if you have thyroid issues? By the way, your basal body temperature, that temperature which you awaken with in the morning as you emerge from sleep, before you swing those feet out to hit the floor, your body temperature is the lowest it's going to be all day. The moment you swing the feet out, they hit the floor, you start walking away from bed towards the bathroom or the kitchen, wherever you normally go, the engine starts to rev up a bit, the temperatures rise, and those temperatures are no longer at a basal body state any longer. But what is your temperature at its basal body state? I can tell you what it should be. We learned from Dr. Roy Carey that it should be between 97.8 and 98.2, and I just wonder what yours is. By the way, if it's 97.6, you missed the mark. If it's lower than that, and by the way, I've had many, many patients with much lower basal body temperatures, way down in the 96s, and I often even question, my goodness, what a miserable life that must be to have basal body temperature so low. That means the thyroid affects so many different things. We'll talk about those symptoms, but won't talk about it now. But what's your basal body temperature is something I always want to talk about. Also, too, what is, talking about asking your doctor to do blood tests on you. The first one doesn't require any blood tests. You're going to end up being able to determine your thyroid state on your own. But with respect to whether or not you're a closet diabetic, I introduced that term last month. Are you in the closet when it comes to your potential to develop diabetes or not? Have you already developed it and don't even know it? Well, I think what you got to do is get something called a hemoglobin A1C. Write that down. Hemoglobin A1C. Ask your doctor to run it. He won't run it on you unless you already have been diagnosed a diabetic. I think it's a big problem out there. I think that the fasting blood sugar approach to only diagnosing someone with a diabetic issue, if their fasting blood sugar is out of line, out of whack, and then and only then getting hemoglobin A1C is a giant mistake performed by our well-intended, very well-educated doctor community out there, because the fasting blood sugars could be so normal looking in the morning, and yet the blood sugar itself so deranged throughout the rest of the day. Hey, that's what we got started with. We're going to take a short break. When we come back, there are a number of things that your local hospital wouldn't want you to know. What your local hospital is hoping you won't discover. 8 closely guarded secrets you must know about, especially in the month of July. We'll get back and we'll talk about what the big 8 are on our return. See you in a moment.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruit native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, everybody. Welcome back to AM Impact on Your Health here on this very bright, sunny, and very gorgeous Monday morning version of the show. We've allowed you to, and we're going to continue to allow you to come on in and knock on the door and, well, set the agenda around here if you'd like to do so. If you'd like to just ask a question, make a comment, anything on your mind is okay with me. That number, of course, 412-825-6262. I'll be waiting for that knock on the door. I should also mention a little note here in my calendar book. On the 8th of August, I'm supposed to call Cass Ingram. Why on the 8th? Because he's coming out of the woods on the 7th. He and a group of folks are up, and I think they've already left. They're up in the province of Manitoba in Canada, and they're going into the woods, folks. Now, look, if there's any guy that deserves to be able to do that, after writing the book, The Cure is in the Forest, his newest book. He talked about that last week when he was here with us, and how powerful what could be learned on a trip such as this could be. So he's taking a crew. He invited me to go. There was such short notice, I really couldn't do that. I couldn't take him up on that. And just maybe on the next one, I can get enough advance warning to be able to juggle my schedule around. Anyway, he promised to come back on the show, as you all remember, and talk about his previous book, which was Natural Cures for High Blood Pressure. That book was one of the first he ever wrote. And he's written so many, I think 8 books total he has written. Anyway, I'll be checking in with him on the 8th of August so we can set up a time that he can come back on the show and promise to me he will be talking about it. Of course, on his last visit here, talking about the power of the forest and the toxic. Hey, I wonder how things are shaped. Looks like that Bonnie never turned into a hurricane. I don't really ever think it was forecasted to do so. How far the rains that go with Bonnie will be moving inland, and whether or not they'll ever make it up here, I'm not so sure that it even will, but they're certainly going to be dumped on a whole bunch of people. Remember, the topic was how to prepare for your toxic summer, and he and only he could make that association between the Gulf oil spill and how you, up here in the north, up here in Pittsburgh, have to worry about all that toxicity being dumped on you by the first hurricane. Well, we didn't have the first hurricane, and when we do, I guess the likelihood is that we can suffer the ill effects and consequences of all that toxic stuff that's going to be generated from passing over the Gulf. Anyway, get ready for, there'll be more on this subject. If you have a previous condition, especially a respiratory condition, especially if that comes in the form of, well, how about just asthma, asthmatic bronchitis, chronic obstructive pulmonary disease, emphysema, you are the folks at most risk whenever that toxic cloud dumps that rain on us. At least so says Cass Ingram, and I believe he's right. He's absolutely right. And so prepare for it. He's saying you should be taking oregano. He said especially the drops. This is an antimicrobial, and its antimicrobial properties is what you would be taking it for. And then, of course, he brought in that discussion once again that he originated with us the previous visit to our show, talking about this unique substance, chaga, that comes from birch tree bark, literally a saprophyte on the bark that protects that tree. That's, by the way, why he says turn to the forest. If you want answers, look how that nature actually protects itself. And when it comes to trees, those huge trees are protected by this chaga. Why is it? Well, we learned that although there are many properties of chaga, there is one property that makes it quite unique in its ability to present to the human an enormous amount of SOD. Of course, that stands for superoxide dismutase. It's one of the body's own antioxidants, and the benefit to you is enormous should you get large quantities of it. He said best to do it in the form of a new product put out by the company that he represents, and that's called Chaga Tea. And our shipment will be coming in here very soon. What a great way to I haven't tasted this stuff yet, and he claims that it's quite palatable, very good tasting. And so that's a good way to get SOD. I'm sure it's going to be picked up quickly by you all, and you'll be coming by and getting your box of the stuff and taking it home with you. Now, while we're waiting for you to knock on the door, 412-825-6262, Joe hit a chord. Joe, I'm talking about Joe McCullough. He does a great job with his website. And as all doctors know, July is it's a shaky time around hospitals. And that prompts all of us, all medical doctors, to think a little bit about some hazards that occur in July in hospitals that just don't occur any other times of the year. And I think that's what prompted Joe, although he didn't mention it, I think it's what prompted Joe to just do a little expose about what he entitled, What Your Local Hospital is Hoping You Won't Discover. It says there's 8 closely guarded secrets that you must know about, and he says especially in the month of July. So with respect to hospitals, we have to have them, yes we do, but they haven't held up their end of the bargain. There's a whole lot to be discussed when it comes to going to your local hospital. These are the 8 things that just came to mind for Joe. He jotted them down. I think they all have merit. Let's see if you believe in them too, or believe that they may be a factor in whether or not you'll be going to your local hospital. No one actually goes to a hospital for the heck of it. You're going to need to go to a hospital if you're going to be in there at all, and you just have to be on guard. Here they are. Number 1. I love these lists. Don't you like lists? Number 1. It says stay healthy in July. Why July? Why is July the most dangerous month to visit a hospital? Well, the reason that question can be asked, and the answer is that's the month when student graduates from medical schools start doing their residency in the teaching hospitals. And the death rate due to this changeover of essentially young kids coming out of medical school and starting their training, the death rate goes up by, they say, a spike of 10% in the month of July. I didn't know about the number, 10%. I could understand, and I've always heard, hey, be careful this month of July, who takes care of you? And so if you have to be in the hospital, if you're in the hospital now, we're coming to the end of July. The kids are doing their residencies. They're in positions of responsibility, especially when evening rolls around. When the daytime issues are going on in the hospital, there are plenty of attending physicians around, and so even the young ones, even the rookies, have enough supervision and guidance. But guess what happens when the lights go out? There are no attendings there. The whole hospital is run throughout the entire evening and well into the next morning by nothing but the residents and the fellows. And first up, the first ones that have to respond, I remember this rather vividly, in that time point, the phone call goes to the intern on call. That being the newest one. They field all phone calls that come from the floor, and hopefully their judgment skills are up to snuff, and that they can realize early what is extremely important and get the next guy up in the food chain to respond to. And if it's needed, there'll be about 4 levels of buffering, but if you reach the 4th level, the final call, if it has to be made, could be to an attending physician who's, of course, at home, but at least it'll have to go through all those steps before a phone call can be made. So I pull back the curtain just a bit, as we like to do here so often, give you a peek behind the scene, the wizard, take a look at the Wizard of Oz with the curtain pulled, the emperor with no clothes on, so to speak. It's just, you need to be mindful. If you're in a hospital environment in this month of July, it is a treacherous month, and you need to be asking for the next level of scrutiny. When the intern shows up, it's going to be a nice person, believe you me, and that guy's going to be great in days to come, but the likelihood that in the month of July, you've got Albert Schweitzer showing up, take care of you, isn't really, the likelihood is very low. Okay, so stay healthy in the month of July. Number 2, hospital wait times. I hadn't thought of this one. Joe did. Hospitals have terrible wait times, which may actually be endangering patients. Patients who need to be seen within 14 minutes of arriving ended up having to wait more than twice that long. Hey, I think 14 minutes is actually pretty quick. Even 28 minutes. Geez, I don't know where they're getting that statistic, because I know it can be longer than that. But keep it in mind. How about this one? Didn't think of it. The rise of bed sores. I know that every good nurse takes it personally. And I can say this from a perspective as a physician, as well as perspective from a patient. Take it personal if any of their patients happen to develop what in medicine is called a decubitus ulcer. You may call it a bed sore, we may call it a decubiti, we may call them decubiti, but there's a lot of red faces and a lot of upset medical staff if a bed sore develops. In recent years, a number of hospital patients suffering from bed sores has increased significantly, and I'll tell you what, it surprises me to know that. In order to prevent them, ask your doctor or whoever is accompanying you to make sure that you change positions every couple of hours. This is what the nurses have drilled into themselves. They police their own, keep the gym clean, and prop yourself up and so forth to relieve pressures. But bed sores actually should be a thing of the past, and I thought they actually were. Come to find out, maybe not. How about this next category? Oh boy, have you heard about this category. In the number 4 slot, the risk of infections, these nosocomial infections as they're called, where you walk into a hospital vertical, you are seeking medical care, and unfortunately you could be hauled out of there horizontally because of the possibility of a nosocomial infection, a hospital-acquired infection. They say there's 1.7 million cases of hospital infections every year, 99,000, I remember this number vividly, 99,000 deaths that are related to these infections. That is nothing to sneer at, and those infections alone need to be dealt with, and can be, by the way, if you can insist. We won't get into the actual protocol we put together, but essentially is anybody that comes in to approach you or your loved one better be gloved or have their hands washed, or they don't get the touch. Just let it go with that. How about this one? Brand new. I guess it's in the realm of what you have to expect in the computer generation, but I didn't realize that medical identity theft is the issue that it's become with respect to the hospitals. They say today 1.5 million Americans had their personal information stolen so that someone else can use your health care to cover their costs. At the moment, the hospitals are struggling to deal with this problem. Believe you me, has to have passed under my radar screen, but one of the first things they're going to ask you when you go to the hospital is, okay, I have your insurance card, please. And all of a sudden, everything gets opened up to you. The entire keys to the kingdom get passed off to you as long as you present that card. And I'm not seeing them, now that I think about it, going into, it's not like trying to check into an airport. They say, give me your card. Whatever you give them, it's pretty much accepted. So, be very careful with that card. But evidently, people out there like to get their fingers on it. The list goes on, according to Joe. Bills, they say. And this is a little known fact that the hospital doesn't want you to know about. Bills that you generate at the hospital are negotiable. They may be negotiable. Most Americans have been the victim of hospital bill shock at one point or another, but it's important to remember that some of these bills are negotiable. Some hospitals have been known to drop the price by a third or more. So don't let the sticker shock get you. These are negotiable bills. Hospitals scan your credit reports. Did you know that? They do. Some hospitals have taken up the controversial practice of looking at patient credit scores, credit card limits, and even 401k information. I didn't. No way. Well, it just says it's so. It's so. The issue has raised privacy concerns among consumer advocacy groups. Now, this last one, the number 8th one, has a special place in my heart. You'll see in a moment exactly what I mean by it. Talking about get to know who? Get to know your anesthesiologist. Geez, I didn't think we rated that much of a concern that a non-anesthesiologist like Joe Mercola, would put us in such a prominent place. But he's right, and you would be right, especially if you have surgical issues looming. You'd be right to get to know your anesthesiologist real well. And Joe goes on, an inept anesthesiologist, oh boy, can cause serious harm to a patient, including death. In the worst case scenario, it's best to request an interview. Here's a new one. Request to interview your anesthesiologist before your procedure. Now, he or she should be coming to interview you. It's called a pre-op evaluation, and that absolutely by law has to occur. But you know what? There's a lot of tension there. There's a lot of the looming OR doors tend to make that a very uncomfortable experience. What you want to do is have a discussion with the anesthesia group at that hospital, a representative of the group of the hospital, way before the day comes. And I know with the way hospital admissions work today, you literally sometimes are taken into the hospital, and within an hour you are off to the operating room. So I suggest, and I have a little personal knowledge in this, that prior to your surgery, prior to the day you show up, and have not met an anesthesiologist, it's on a prior visit or a prior phone call or some prior previously arranged way to do so, you need to be having a discussion with the anesthesia personnel, particularly anesthesiologists, allowing in a no-threat environment. Your surgery isn't today. Your surgery may be set for a month from now. Let's see about the right time frame. This is the time in this non-threat environment to have a good interchange between yourself and the anesthesia community, in particular the anesthesiologist. And if that gentleman is, and it may just be a personality clash, you may want to meet another individual from that division of the hospital. But I think the words are wise and should be wisely interpreted as a benefit to you. Get to know your anesthesiologist way before the surgery ever takes place. And there you have it. The 8 things, the 8 closely guarded secrets you must know about, especially in the month of July, as per George Poland. All right, let's take a short break. I've got things on the plate, but you may have worked up a little bit of a lather waiting for this opportunity. The number 412-825-6262. Come on in, give us a call. Let's find out what's on your mind. Anything is okay with me. Be back in a moment.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen, and welcome back once again to AM Impact on Your Health. Here in this Monday morning version of the show after that gorgeous weekend. Soggy yesterday, I know. Saturday pretty good. Sunday, I'm not so sure. Today, outstanding. Hope you all enjoy it. Hope, by the way, you too are enjoying our show today. We're allowing you to come on in at any time to step up and ask the question. Anything on your mind is okay with me. 412-825-6262, and I'll wait for that knock on the door. You also may have some requests about shows you want to hear in the month of the week of August 16th to 20th. We got 3 slots. We'll be filling them up with some show, and if it's one that you'd like to have repeated, I'd be more than happy to do that for you. Now, I want to mention, and I'll let this caller come in a moment. When we went to a commercial break, another issue about anesthesia and surgery. As an anesthesiologist, I'm allowed to have a few choice pieces of information to pass on to you would be what form of anesthesia to avoid. I think I let it out of the bag about a week ago. I'm going to come back and hit it again. But let's talk to the person who just knocked on the door. Come on in the store. Hello and welcome aboard.
Hey, Doc, what's happening up there?
Danville, how are we coming through down there in Danville, Virginia?
Man, you're always coming in good. It was 100 degrees yesterday.
Oh, you know what? We hit 90s. I don't think we hit 100, and we're nice and cool today. Did we send you our cooler weather yet?
Oh, I don't know. I think that they say the high, low pressure, high pressure. I was going to ask you something. My little son, he's got a cyst above his eye, and we went up to Charlottesville, which is, to an eye surgeon. Now, I asked, you are a former anesthesiologist. Well, no, you're still an anesthesiologist.
Well, once one, always one. I don't go in the operating room much anymore.
Well, I think they're going to give him what killed old Michael Jackson, and I don't mean the Ativan. I think it's the propofol. Is that okay for a 4-year-old?
Well, let's just get into the issue that I wanted to talk about. The first thing is, by the way, how old is your child?
4 years old.
All right. There's not, because of this 4-year-old, being a 4-year-old, there's no way that you can talk a child down into being able to have this done under a local anesthetic.
Oh, yeah.
Like you could an adult. So, right off the bat, you don't have a choice. This child needs to be put to sleep for the surgery. Thank God it can be done so in the case of the child. And in the right anesthesia hands, no problem. Believe you me, I don't want you to get hung up on that. And propofol is just, I'll call it the hammer. In the day of my learning, when I was a resident in anesthesia, the primary medication used as the hammer was called sodium pentothal.
Oh, yeah.
And then while we were, having sodium pentothal, it was pretty inexpensive. The white milk, which is what propofol looks like. It looks like milk. It's white. It's a fat-soluble substance, and it came into being. It really got quite a bit of popularity because when we used it, there were some definite advantages over the pentothal, and now it's the #1 used way of plunking you and getting you off to sleep very rapidly and very pleasantly. It's done in an OR environment. Don't be worried about the Michael Jackson scenario, which was done as literally in the back seat of a Chevy. Okay, this is not the place. His home, or no matter how much equipment was in the home, this wasn't the right environment. But in the case of your child, please don't have any fear at all. Meet your anesthesiologist. You heard me talk about it a moment ago. Get a very good rapport with the anesthesiologist. He or she will make you very comfortable. And in a 4-year-old, there's really no other option here. It's too traumatizing for a 4-year-old to have anybody approaching them in an OR environment and just by saying, well, we're going to sedate you, which you could do in an adult. An adult could easily have the same surgery done under a local anesthetic.
Right.
A 4-year-old can't.
Yeah, because when I was talking to the I guess it's just a cyst above his right eye.
Sure.
Kind of. But the doc, he said, forget it, this propofol. I said, well, yeah, I said, I thought they stopped breathing. He says, no, not all the time. Sometimes they,
Well, if they can, one thing nice about the propofol, which we really couldn't do with pentothal, is they can establish a drip rate that just keeps the person to the point where they have no awareness, yet their own breathing is not compromised. Okay.
Yeah.
Now you're in an environment where the patient, in this case the 4-year-old, will be inhaling oxygen. They'll be able to get usually nasal cannula, maybe a face mask, who knows here. But as long as the respiratory rate is unchallenged, you won't even have to be intubated, which I guess is exactly the intention of this particular anesthesiologist. It certainly is done every single day. They use propofol out on the floors in monitored units, and so it is a well-known, very safe medication used in the proper setting. And with any anesthesiologist in an OR environment, that was the setting that was originally that propofol was originally designed to exist in. And as a result, the worst thing that can happen, what? is that the respiratory rate would be so low, they'd actually have to take over and do mechanical ventilation. They'd have to breathe through the child, which is what they do in every single surgery, whether it's general anesthetic that's been delivered. So, please, when is the surgery supposed to take place, Danville?
The 20, I think 20, when is Edward getting surgery? 27th? 25th of August.
25th of August.
Because he's, I know one thing that, I feel bad for that poor doctor, the Murray guy, the cardiologist that got with this Michael Jackson. I guess, are they going to lock him up for this, you think?
You know, I wouldn't be using the words I feel bad for. He used a drug outside of a hospital situation that should never have been used at all, and as such, I'm not too happy with what is his name, Doctor. What was his name?
Conrad Murray.
Dr. Conrad Murray, who's supposedly a cardiologist from Houston, if I remember correctly. He may be a cardiologist. He isn't anesthesia trained, and he should not be using, and nor should he have used.
I remember you told me one time when you were doing anesthesia, you said that sometimes people would get Ativan and they wouldn't wake up for like.
No, what I said was if there was any issue of emergence from anesthesia too early, if we worried about recall, because it's a terrible thing that we're always we in anesthesia are aware of. If we thought there was even a possibility of it, we would use Ativan to help remove the memory issue. I mean, when you have been given a milligram of Ativan IV, you sometimes don't know your name for a while, okay? So
that never happened.
That was
Yeah,
used in self-defense many times because you didn't want to have the person have what's called recall of any adverse, sensations and experiences from that surgery. And with Ativan, at least you could spare them that. Anyway, good luck. It's not luck. This is not luck. This is a skilled science, and you got the right people doing it. And keep it up. Your child's going to be just fine.
All right. You have a good one. Watch out for that heat.
I will.
All right, Bubba.
Mayhap. Danville has checked in, folks. He has just left the building. But picking up on that. And it came out, I think it was last week, we had a caller call up, and she, if I remember correctly, was going to have a surgery, a knee surgery, if I'm remembering correctly. And her question to me was, what kind of anesthesia should I have? And having just talked about, your anesthesiologist, we just had Danville weigh in on the kind of anesthesia that absolutely needs to take place with respect to a 4-year-old. And propofol, which is that milky stuff, yes, Michael Jackson was done in with that stuff, but it was in a bedroom, in a home, for God's sake. There wasn't the right environment to be using this stuff, and certainly there was no anesthesia personnel around, which is, these are the people who are designed to be able to utilize the meds. Now that it's out of the OR, it can be potentially brought to your home. Boy, you really got to be careful if the word propofol is ever brought up. But back to the point, and keep it in mind. I said then, meaning last week, when this question was asked of me, that, and now I'm going to explain myself, that what you want to do when you're going to have a surgery, if at all possible, you want to avoid general anesthesia with all effort and all ways of resisting it, and opt for any other form of anesthesia other than general anesthesia. The general anesthesia is being put to sleep for that surgery. And so here I am, an anesthesiologist, have put many a person to sleep for a surgery. And why is it that I'm saying to you, hey, look for another form of anesthesia for your surgery? Well, the reason I'm saying that is I would do the same, and so would every one of my colleagues who was to have a surgery. I'm talking about, they're all anesthesiologists now. These colleagues of mine that I'm talking about would all opt to avoid general anesthesia if at all possible. Why is that so? Well, we, who I think would be in the know, are saying that the greatest risks, and this all is reduced to a matter of risk. What is the least risky form of anesthesia all the way to the most risky form of anesthesia. And I guess the hierarchy goes something like this. Number one would be IV sedation. The first question out of the mouth of a patient shouldn't be, and actually it doesn't usually come in the form of a question. I can tell you that the most common phrase ever brought to my attention when I saw a patient who was OR bound and needed to have that interview with their anesthesiologist to do the workup, the most common phrase out of the mouth of the patient was, "Doc, glad you're here. Look, just," here comes the phrase, "knock me out. I don't want to know anything." And in some cases, when I looked at the medical history of that patient, I found that, you know what, we can do just that. I'm not going to get this person worked up. Wants to be knocked out, meaning put to sleep under a general anesthetic. He's healthy enough. There's no risks here that would try to persuade me as an anesthesiologist not to consider it. And so I left the room and we let this patient just get that off his chest. But if I were to look at that same patient who may be on 4, 5, and 6 medications, may have had previous myocardial infarction, could have, and here's a big one, lung disease of some type, then we're going to have a talk, because whether he wants to be knocked out or not is not the question. It is, what's the safest form of anesthesia for he or she? So, I say take the hierarchy, go with the least risky, work yourself towards the most risky, and the least risky of all is something called IV sedation. That's using, you're not put to sleep, but I'll tell you what, you'll have no memory of the event. It'll be in a safe environment. Your anesthesiologist will keep a watchful eye over you. If you need any more profound forms of anesthesia, he'll be prepared to administer them. But the plan will be to start with IV sedation. That's the first request. We'll get into the second and third in a moment, but we get a knock on the door. Come on the store. Hello and welcome in.
Morning, Dr. Courtney.
Hi.
What a way to start the week. You're scaring the heck out of us.
Oh my goodness gracious! I want to put you all these, but I want you knowledgeable. I want you knowledgeable.
The message I'm getting is try and stay out of the hospitals. Try and stay out of the system.
Isn't that the idea of the show today? What's your hospital? And hey, Joe Mercola, last one of the 8. Know your anesthesiologist. Boy, that's
so better forearmed with knowledge. I'm all for your show. I did want to highlight something just real quick. I know we're running out of time here. But in the July 21st Almanac, which is the South Hills Community Newspaper.
Oh, I know it, yeah.
On B6, there is an article. It's called Mammograms Essential for Older Women. I know this would nauseate you if you read this article.
I missed it, yeah.
It's such a setback to what you're all about. It is really terrible, and it's one of your comrades out your way, McMurray, was quoted to this Dr. Donald Keenan, and I'm telling you, so retro. But I just thought I'd alert you to the fact if anybody can give you a copy.
I don't know, Donald. If I did, I'd personally call him up. Is it last week's advertiser?
Yes, July 21st issue.
I'm going to try to dig it up. I think I know exactly where it is in my home, and I'll dig it up. And, of course, as you would well know, it wouldn't sit well with me. And once I read the article, I'll bring back a comment on it, okay?
Oh, absolutely. So
all right.
Anyhow.
I don't want to scare you anymore, but you got 2 more forms of anesthesia to go. I figure I'm going to round out this research. Okay. All right. Now, look, my intention is to scare you. I always say my intention is to educate you so that you become an informed consumer. I don't want you to be that person that shows up and says, knock me, and don't tell me a thing, doc, just knock me. Okay, go from the least risky form of anesthesia, which is IV sedation. The next form of anesthesia that's a little more risky, but still much less risky than general anesthesia, is spinal anesthesia. That's what I told the patient who called us up last week to have, I think it was pretty sure, a knee surgery, and or it could be hip. Anyway, if the surgical site is from the belly button down, spinal anesthesia. is the way to go. That's a complete form of anesthesia, but you do not lose the sensorium. You are awake. Now, awake means you're going to be sedated. You're not going to remember anything about the surgery either, but the anesthesia is absolutely 100% complete, and you don't have to do any intubation and get in with a myriad of drugs as you do with the third form of anesthesia, the one that I say that myself and all of my anesthesia colleagues, all who are anesthesiologists, would say that the one that is the most risky form of anesthesia is the one that John Shoe Public comes to me and says, "Doc, just knock me out. I don't want to know a thing." And that is why sometimes we have to have an unpleasant discussion, because maybe it's just a little too risky in this particular case. There you have it. We pulled back the curtain some more today, didn't we? The Emperor now certainly has no closet, walking naked down that street. Hope you enjoyed our discussion today. I'll see you on Wednesday. Doug Inglesby is going to be with us then. Until then, this is Dr. Dennis Courtney saying so long for An Impact on Your Health.